Okay, I think we're going to start. Good afternoon, everyone, and welcome to our inaugural Dean's Distinguished Lecture Series on Health Equity. And it's a perfect forum for our National Public Health Week. It's really a pleasure seeing so many of you here in person today, as well as on Zoom, to talk about advancing nutrition in the 21st century. As academics and healthcare professionals, this is an area that needs more research-driven, science-based, and community-partnered solutions. I'll assume that all of you are here and watching online are motivated to learn more about how having access to and consuming nutritious foods can positively impact population health and well-being. Nutrition security are critical components of a healthy society. Unfortunately, not everyone has access to the necessary resources to ensure adequate nutrition, from availability, access, and utilization. Communities are impacted by nutrition security on both a physical as well as a mental level. Even here at UCI, it may be surprising that our own students face insecurity with basic needs. And it's really important to know that we do have the UCI Basic Needs Center to help support them. And that's one of the reasons we've assembled this expert panel. But before I introduce our esteemed experts, I wanted to give you all some wonderful news that makes all of our work possible. I think most of you know, but I'll say it anyway. 2 days ago, we publicly announced a $14 million grant from the Irvine Health Foundation. This landmark grant will really exciting. The landmark grant will establish 7 endowed chairs over the next 7 years to recruit and retain leading experts in the public health field who strive for health equity in our communities. And that's one of our fundamental values in public health. Now, speaking of experts, let's get started with introductions. Today, we have assembled an esteemed panel of researchers, community advocates, and clinicians who will share their knowledge and insights on various topics related to nutrition equity. I ask that each panelist join me up here. First, Denise Payán, who is an assistant professor within the Department of Health, Society, and Behavior in the program of Public Health. Next, Karen Lindsay, who's an assistant professor of pediatrics at the UCI School of Medicine, an early career chair at the Susan Samueli Integrative Health Institute, and an affiliated professor in our Department of Population Health and Disease Prevention. Next, we have Evelyn Gonzalez, who's the Director of Wellbeing at Northgate Gonzalez Markets. Evelyn is a member of our UCI Public Health Community Advisory Council and also a proud UCI alumna. And last but not least, our soon-to-be assistant professor within the Department of Population Health Disease Prevention, Matthew Landry. Matthew's arrival signals a true investment by UCI Public Health in improving our understanding of the role nutrition plays in maintaining and improving our health. We're also in the process of recruiting a faculty member with a background in nutrition policy and to be at the forefront of training future leaders in this area. We're in the early stages of establishing a Master's of Science in Nutrition. I'd like to acknowledge those faculty who have already engaged in nutrition in our program: Susanna Bick, Andrew Odegaard, Karen Edwards, and Young Shalou. And I want to recognize Dr. Shaista Malik, the founding executive director of the Susan Samueli Integrative Health Institute, who's really been a strong voice in integrative health and who had the vision of creating a teaching kitchen in the College of Health Sciences to advance nutrition awareness in the community. And thank you so much for doing that. So we're really looking forward in public health to work with the Institute as well as the schools of medicine, nursing, and pharmacy on issues related to food and nutrition security. So with all of these initiatives, we're ready to take nutrition equity research and partnerships to the next level. So we're going to get started. And we're going to hear from these amazing panelists, but a few housekeeping reminders. I ask that you save any questions that you have for our panelists until we open it up after their presentations. For our Zoom audience, please feel free to use the Q&A function. And then lastly, hopefully all of you will be joining us for the reception, and which will take place on the terrace above us and outside, and you can just use the doors you came in. So without further ado, I'd like to welcome Denise Payán to get us started. Denise came to us from UC Merced a little while, I guess a little under 2 years ago. Denise's background and work is focused on community health policy, specifically on obesity and nutrition-related race ethnic health disparities. Denise, thank you.
Okay, welcome, everyone. Thank you so much for that warm introduction. And it's so thrilling to see so many students, faculty, staff from UCI, from different programs and schools, but also we have members of the community who are leaders in these areas, in the area of nutrition. So I'm really excited that you could all be here today in person. So to kick off the panel, I'll be focused on advancing nutrition equity in my presentation will focus on advancing nutrition equity with policy, systems, and environmental change. So I'll start off briefly with the motivation. So what is the impact of food insecurity and diet-related disease in the United States? This really focuses on individual and population health impacts. So you can think about some of you may know, the food insecurity is associated with worse health outcomes and worse health behaviors like lower diet quality, certain diet-related diseases like type 2 diabetes, cardiovascular disease. It's also associated with a host of economic, social, and educational outcomes. And so, and also premature death, right? Kind of the worst outcome when we think about population level health. And food insecure individuals are also at higher risk of anxiety and depression. So there's a mental health component in addition to the physical health piece. And you can see I just highlighted here, you have impacts, reduced academic achievement, reduced workforce productivity, and increased healthcare costs. So for many in the audience, regardless of your area, we can think the motivation is related to a broad variety of outcomes. So what factors contribute to food security? And so this comes from a conceptual model that I often use in my work and my research. These 5 components, availability, access, adequacy, acceptability, and agency related to food and food systems. And so the more familiar are actually availability and access. So availability would cover, is healthy food available to folks? And is it available relative to higher calorie, less nutrient dense foods? So there's some concepts like food deserts, which focus on the availability of healthy food at the neighborhood level. There's also food swamps. If you haven't heard of that before, it really takes into account some of these food deserts do have a lot of food available, but it is not health promoting. And so the availability focuses on these pieces, and there's been quite a bit of work in this area. Access is something that our students can particularly speak to, but households and everyone would think about the role of the affordable, whether food is affordable, whether healthy food is affordable, what is the cost? And so these are really pieces that I think are more common knowledge, but along the food security kind of the different components, I have focused more on agency. What policies or processes exist to promote healthy food access, healthy food utilization, and consumption? And so most of my area has focused on policies and programs to improve diet and nutrition-related health outcomes and to reduce disparities that exist. Most people think of laws at the federal, state, or the local level like ordinances. Some of the work I've done relates to policies at those levels, but we should also think about community settings, organizational policy. So I've also done work with schools and churches and healthcare organizations like federally qualified health clinics, because the decisions made there do impact nutrition outcomes. And so increasingly, I have been moving to acceptability, this piece that's very understudied. Is the food culturally acceptable or preferred by the populations and groups that receive it? And so I'll just briefly highlight a study from during COVID-19 with colleagues at UC Merced, where we interviewed Latino immigrants in agricultural and lower income, more rural counties in California. And this piece really speaks to, we eat food not only because of the nutrients, but for social reasons, for cultural norm, and cultural reasons as well. We need to take this into account in our interventions. And so with that study, we found that more Latino immigrants in the study were accessing the charitable food system, as opposed to the Federal Nutrition Assistance Program, SNAP, which is known as CalFresh here. And I'll just highlight, so they were accessing the charitable food assistance programs like food pantries and banks more often than SNAP due to immigration concerns, concerns around legality, and also stigma. However, in the charitable food system, and I'll highlight just one quote, some of the challenges were that the foods that they were receiving were not aligned with their cultural preferences or norms, and they were adapting their diets. And in some cases, wasting the food was kind of, could have been the result. And so this was a low food insecurity individual who was interviewed, who said Latino food in particular, it is tortillas, salsa, sometimes red meat or chicken. We have had to change our food for canned food for sandwich bread that was being given out by a pantry that they access. This is a generalization, right? Not all Latinos eat tortillas or red meat, but it really does speak to this important area where we need further research about the food distributed through the charitable food system. And it also kind of broadly speaks to, we need to pay attention to food and nutrition environments. They're very important. And so here you see kind of the life course stage, nutrition research being conducted using this life course perspective, because the orange, the earlier stages of life, really focusing on prevention can have better and have higher impact kind of outcomes over time. And so I'll just highlight, I want you to think about this, locating your research of the work that you're doing. And panelists will speak about some other areas, but I wanted to highlight two different studies just briefly. One was a study where we surveyed young mothers or early mothers with infants during the pandemic. And we found that 1 in 3 families who fed infants formula reported using more than one deleterious or harmful practice, which could include like diluting the bottle or using more water. And so it's really important to pay attention to some of these changes and kind of exacerbation of disparities. And another study that's older, we studied structural barriers to school lunch meal access in low-income communities in South Los Angeles, and found that long lines were a big problem for students in these schools to access healthier school meals. And so I want to talk about policy as a public health tool. So how can we address these specific problems? And one would be thinking about different policies that states have taken on. So on the left, you see paid family leave policies. A small number of states have that, including our own. And then you also in the green, you can see a universal school meal. So these are 2 policy tools that exist that states are adopting, but are not yet federal legislation. And they look different. So I'm interested in thinking about, and I encourage you to think about policy advocacy to create supportive environments for better outcomes. We should also pay attention to local and global nutrition policy, like sugary drink tax policy. So Berkeley's our example. But globally, we have a lot of other really interesting, exciting examples that are evidence-based. And so here you'll see this is front of package labeling that Chile has adopted. Mexico has also adopted this policy. How can we learn from these policies outside of the United States or at the local level? Briefly, I just want to touch on food security. It's not only nutrition, but this is also impacting other social determinants like the environment. So the environmental impact of food, these are a couple of resources that focus on food production and its potential harm to the body, to the people who are producing food. You can think about how heat-related stroke and exhaustion for people in the system, but also Dr. Mike Mendes, who's a UCI professor in social ecology, wrote Climate Change for the Street about solutions from the grassroots level to address and promote policy. And then these are some of the impacts, environmental impacts of food waste, which is a very understudied area. And so here, this is a food recovery hierarchy. So how can we integrate these components into existing interventions? And so and I'm really excited by the innovative approaches across sectors that other panelists will talk about. We'll talk about food as medicine, Northgate Market, which is doing really great work in the retail environment. And I also want to highlight nonprofits that are doing this work here locally. So we have actually the CEO of Second Harvest Food Bank of Orange County here, Claudia Kaller. Thank you for being here. Where this food bank is actually centered nutrition as part of their work. And they have a really great 45-acre farm where they also distribute and produce their own produce. And then we have, I'm not sure if Bill Bracken is here, but Bracken's Kitchens doing really innovative work on poverty alleviation, culinary training, and food recovery. And providing tasty meals, right, as part of our charitable food system. So with that, I thank you again for this opportunity, and I'd like to welcome Dr. Karen Lindsay, who's a registered dietitian In addition to her Samueli Institute and School of Medicine appointment, she has an affiliated appointment with the Department of Population Health and Disease Prevention. And she's a clinical expert in women's health and maternal nutrition in pregnancy and focuses on the first 1,000 days as a critical period for nutrition. So thank you.
Thank you so much. It is wonderful to be here as part of this panel. And I am going to talk to you today about some of my research focused on nutrition equity in the first 1,000 days and opportunities to advance maternal and child health. So the first 1,000 days represents the period from conception, which is the very beginning of pregnancy, until the child reaches age 2. And this is a very critical window of development where nutrition plays an important role that influences the propensity for health and disease risk across the lifetime. For low-income families, nutrition may be an issue in terms of all the issues that Denise highlighted in food insecurity. But there are federal nutrition assistance programs such as WIC and CalFresh, which do support mothers and their children during this life stage. But there are still persistent inequities in food security. So for example, in California and Orange County, overall, the food insecurity rate is about 9%. But when we break that down by race and ethnicity, we see about 14 to 15% rate of food insecurity among the Black and Hispanic households. And that is compared to only a 4% food insecurity rate in white households. So in one of my studies, which involved pregnant women recruited locally in Orange County, where 84% were self-identified as Hispanic, we assessed their food security rates and found that almost 22% of these pregnant women had low or very low food insecurity. And this is obviously a big concern because, as I mentioned, this time period is very critical for early fetal development. And if there is inadequate nutrition during that life stage, it can have implications for the health of that offspring. So we did assess their dietary intakes of these women as well as their food security status, and interestingly did not find any difference in their overall diet quality using the Healthy Eating Index according to the food security status levels. But we also assessed their eating behaviors and did find that there was a significantly higher trend towards emotional eating behavior among those with low or very low food security compared to those with high food security status. And although we did not find a difference in diet quality in the data, emotional eating itself is usually associated with poor dietary intakes, and just the eating behaviors around it could also be transferred towards the child in terms of child feeding behaviors later on. So in another study, which I conducted with 2 colleagues, where we did a survey of 147 providers from diverse disciplines across California. So they were from healthcare, childcare, community settings, and government agencies. And they all serve low-income families, especially during the first 1,000 days time period. And in this survey, one of our open-ended questions asked about the need that they perceive low-income families have for additional food resources during the first 1,000 days. So this was a qualitative data analysis, and these are the main themes that emerged. So for knowledge and skills, it isn't just about providing nutrition, education materials or counseling, but also practical skills training to help people to introduce and implement healthy eating into their daily lives. Navigation and advocacy spoke about the need for more support and assistance to navigate complex federal nutrition assistance programs or other, knowing what resources are available to them in the community. Access was really highlighted as a barrier quite often in terms of both physical access to stores, Denise mentioned living in food deserts or food swamps, and just the availability of healthy food in their environment. And then on the environmental theme, it was addressing both the home and the community environment, because within the home, sometimes low-income families may not even have adequate storage for food or utensils or appliances for preparing meals. And then the community environment, it could be the safety of neighborhoods, the walkability, transportation options, which can impact their access to food. So some of the direct quotes are displayed here from responses to that survey on that specific question. And these quotes represent the themes that I just highlighted: knowledge and skills, and the access and navigation and advocacy, and the environment. So this survey did go beyond just asking about need for food resources. We also assessed different domains related to nutrition education in the first 1,000 days, the content of that education, how it's delivered, breastfeeding support services, and also professional development needs for other providers, whether they're healthcare providers, childcare settings, in terms of their knowledge and ability to pass on that knowledge about nutrition specific to the first 1,000 days. So the main themes and findings from the survey are listed here, but just to also highlight that access and cultural relevancy was really an underlying theme among all the responses to this survey, because we really learned that from these providers' responses, they believe that if we don't have adequate access, both physical and maybe linguistic access, and if it's not culturally relevant, that Denise highlighted as well, we really need to be tailoring services and resources and information that we're giving to individual and cultural and family needs. Otherwise, it won't be impactful, it won't be utilized. So the next steps and current projects in this area are to develop simple, focused, and consistent nutrition messaging targeted towards the first 1,000 days time period, because we also did some interviews with our survey respondents and learned that there may be a tendency for inconsistent messaging, and therefore, obviously, families are going to get confused if they're receiving different types of information from different sources. And then to put that into culturally responsive nutrition education resources. And one of my colleagues, Trina Robertson, is here in the audience from the Dairy Council of California. And she's been working actually with some of our medical students here at UCI to develop, they got a grant to develop culturally responsive nutrition education resources targeted towards Black and Hispanic families. And that's on a national level. So when those resources are complete, specific to the first 1,000 days, they will be available on the myplate.gov website. And then next would be to assess the family needs and resources for needs and desires for food skills training. So just because some of the providers in our survey thought that that was something that's needed, we also want to ask the end users, how do they want that? How do they see that fitting into their lives? What type of training would they like to have, and how should it be delivered? And once we understand that, we can deliver culturally responsive culinary nutrition training programs to families to support nutrition in the first 1,000 days. And we are equipped to do things such as this at UCI because we do have teaching kitchens, and this image in the bottom right is our beautiful new teaching kitchen here in the College of Health Sciences building, which is currently being used for mostly training medical trainees, and we hope to expand that to other trainees, other students, and hopefully the community setting as well. So thank you so much, and I will pass on to Evelyn Gonzalez. So Evelyn is also a registered dietitian and will share more about her role as Director of Wellbeing for Northgate Gonzalez Markets and their efforts around nutrition equity within the communities they serve.
Thank you all for having me. I'm excited to share what Northgate is doing in terms of community engagement and access to healthy foods. So you might ask yourself, who is Northgate Market, or what is Northgate Market? We're a family-owned grocer here in SoCal. And a little bit about Northgate as well. You might have seen us in neighboring Santa Ana, where we have 5 stores. We're also coming to Costa Mesa this year. And Northgate really is an immigrant success story. So my grandfather started Northgate Markets in 1980, along with his children, 13, pictured here. And they emigrated from Jalostotitlan, Jalisco, Mexico. And really, I think they saw a need in the community. So there was a large immigrant population that didn't have access to the foods they remembered, that they missed from home, right? They weren't spoken to in the language they preferred, right? So really, we at Northgate pride ourselves with our authentic Mexican cuisine. We're still fully bilingual to this day. And this is a typical Northgate if you visit in nearby Santa Ana. So again, a focus on quality Mexican cuisine. We spoke a lot about food deserts, food swamps. We thrive in food deserts and food swamps. So some of our top stores are actually in food deserts or food swamps, right? So there really is a business case of following community needs, right? And I think we also recognize we're more than a grocer. So we're within that community, right? So what else does that community need? So we do partner with organizations to provide things like mobile health units, you'll see in one of the pictures, to do screenings, vaccines, mammography, you name it. We also have bilingual nutrition shelf tags in our stores. We do nutrition store tours. So we partner with school districts to host the little children there in our stores. We're hoping to educate them on healthy eating, so when they come back with their parents, they know how to make healthy decisions. So a lot of community events happening at Northgate, 650 in 2022 alone. And one I want to kind of focus on is Cooking Up Change, because it's students trying to make a difference. I see a lot of students in the audience, so I think you'll kind of see yourself reflected here. And really, Cooking Up Change is a Healthy Schools campaign. So we own the Orange County program along with our partner Kid Healthy. And it's really, you know, high school culinary students saying what they want in their school lunches. And the winners go off to Washington, where they compete nationally, and then they talk to policymakers, like what do they want to see in school? So again, an amazing program, but I'll let some of the kids speak to it in this video.
I think one of the biggest takeaways from this is saying that people, as far as like a student level, can actively make a change in their own schools and their own communities that are for good.
We're the one eating the food, so just being able to plan out a menu that we would actually eat ourselves is just really cool.
I think it really gets to show the kids like that there is more than just putting lunch onto a plate and serving it to them. It's something that is actually like needs to be taken care of, because in order to have strong minds, you need to have a strong body.
So I think we can all agree school meals are really important. I think they're the basis of a child's, you know, foundational nutrition, right? Is those school meals. So how important are they, right? And now I'm hungry. Another program I'd like to kind of promote or kind of spotlight here is a grant we have. So, you know, we have events in our stores in the community, but we also have things like grants. And we have one called the Más Fresco, More Fresh program. It's done alongside UC San Diego as well as the USDA. And it's really a program that rewards participants for eating healthy. And how they do that is they work with CalFresh participants, which is really important because we know they're likely food insecure at that point, and how can we make them make, you know, healthy choices as well. So for every dollar they spend, they'll get up to $2 or $4, depending on their cohort, to spend on more fruits and veggies. So they can get up to $100 more each month in their CalFresh card, right, to spend on healthy food, which is healthy fruits and vegetables at our stores. So really great outcomes so far. We were able to expand the program to all stores at the end of last year. And again, we're seeing a significant increase in the amount of fruits and veggies, you know, eaten by these program participants, as you might assume, but also they're reporting overall healthier eating with this program. And I'll let some program participants talk to this program as well, because I love videos.
Fruits and vegetables, they're both key to maintaining good health. Unfortunately, not everyone can afford fresh, healthy food. In California, Market Match and Más Fresco More Fresh nutrition incentive programs help families buy more fruits and vegetables for better choices, better flavor, and better health. When you spend your CalFresh dollars at participating farmers markets and grocery stores, the Market Match and Más Fresco More Fresh programs provide a match, enabling you to earn $40 or more per month to spend on additional fruits and vegetables.
The program has helped me and my family more fruits and vegetables because they have made them more affordable to me. I'm able to purchase twice the amount of fruits and vegetables I was before.
Program has saved my life. It's been very good. And it's so nice not to have to go to bed hungry anymore.
The Market Match program has helped give me the peace of mind that I don't have to sacrifice healthy eating for my kids and our family. Knowing that I have that little extra amount of money to spend means that we do come here and we spend a lot of money on fruits and vegetables.
Dollars also support local farmers, creating more jobs, and in turn, a stronger local economy for all of us. deserves access to affordable, nutritious local foods. And with these programs, it's possible.
Healthy families, healthy communities, better choices, better places.
I know in my heart a UC San Diego student thought of this program. So just to all the students out there, dream big. And speaking of a student, so obviously our foundation recognizes that education uplifts communities. So we're very focused on education as well. So I invite all the students to visit our website, the foundation page for our scholarships. We also recently invested in public health students because we know what an amazing impact you have in our Santa Ana community. So we recently partnered with some scholarships there as well. So thank you so much. And I would like to welcome Matthew Landry, who will soon be an assistant professor of population health and disease prevention here at UCI. He is currently a postdoc at Stanford University, a registered dietitian, and received his PhD in nutritional science. His work focuses on identifying the optimal diet for chronic disease prevention and addressing the clinical trial challenges that test dietary patterns. Thank you. I said I would get his name right, and I messed it up again.
And thank you for having me be part of this panel. I'm really thrilled to talk about the road forward and how we can collectively work together to be able to advance towards nutrition equity. So right now we have about 75% of all of our healthcare dollars going towards the treatment of chronic diseases. And many of those can be reduced through changing the foods that we eat every day. Now, when someone gets sick, it's of course essential that they have access to quality health care. That's important. But unfortunately, that's the last mile. What we know to be the most impactful thing and to really be able to move the needle and change the health of all of our society is to focus on the first mile and the proactive lifestyle changes that can really have an important impact on health. And what better place to start than here in the program of public health at UCI. Now, during the pandemic in the early stages, we saw those very, very long lines of cars with needy individuals at our food banks and pantries waiting to pick up food that they desperately needed. And we did have that significant sharp spike in food insecurity. However, when we look at the overall prevalence across 2020, it actually remained relatively unchanged from 2019. And that's a big thanks to our charitable food system and also our federal food assistance programs, which change and adapt to this growing and emerging need. However, when we stratify the population by race and ethnicity, we see, unfortunately, a different story. Now we see that Hispanic and Black households compared to their non-Hispanic white households actually had an increase in food insecurity. So our food security programs worked, but unfortunately they just didn't work equitably. So the key now is to go back upstream, to look back at those programs and see where we can use those effective public health strategies to work towards addressing those disparities. And I don't want to discount any of the amazing work that we've been doing for decades when it comes to food security. We've been putting food in the hands of vulnerable people. But we really need to now take a new look and say, it's not just about telling people, hey, eat healthier foods, but also reaching them in those key moments where they make decisions about what foods they are eating. And going forward, we know we need to build on all this success when it comes to food security and those longstanding efforts, but also advance and work towards nutrition security. And this is the consistent and equitable access to healthy, safe, and affordable foods that we know to be essential to our optimal health and our well-being. And the other thing that we need to acknowledge is that structural inequities exist in our food system. And it makes it really challenging for people to be able to eat healthy even when they really want to. So in all of our public health efforts, we have to have that equity lens going forward to help folks out. Now, the White House Congress on Hunger, Nutrition, and Health occurred last October. And that was a truly groundbreaking event, we can say, just like today's event. It brought together policymakers, healthcare professionals, and community leaders to all discuss the issue of food insecurity and its impact on health. And one key theme that really resonated at the conference was the recognition of food as medicine and recognizing that nutrition plays such a key role in prevention, management, and treatment of our chronic diseases. And the conference also really set the stage for what our future efforts should be around hunger and food insecurity. And it highlighted the need for cross-sectional collaborations, innovative solutions, and also a commitment towards equity. So what should our efforts look like here at UCI and across Orange County? So I want to first start very local. As we heard already, food insecurity affects a significant number of our college students, including here on campus, especially those from low-income backgrounds or those that are first-generational students. By some estimates, it's as much as 1 in 3 students. And the pandemic has only highlighted not just food insecurity among these students, but also basic needs security as well, focusing things on housing, transportation, and access to healthcare. And we know that to support students in the best way possible, we have to have this holistic lens and also to promote their academic success. Now, in my research work, the University of California system is constantly being praised for being leaders in this space, especially when it comes to ensuring equitable access to those basic needs. And I'm very excited to come to this campus in particular, because there's already such a strong commitment towards making sure that the campus community fulfills the basic needs of all students. Now, zooming out and looking at our community, I want to use the analogy of bringing people and more people to the table. I think it's a powerful way of addressing hunger and food insecurity. And just like a table that's maybe too small for everyone to sit at, some of our current public health strategies are inefficient or sometimes exclusionary. And to truly address this issue, we need to bring more people to our table. We need to have community members, our healthcare practitioners, and our researchers all collaboratively working together. And by collaborating across all those sectors and those disciplines, we can have more comprehensive and sustainable solutions that come as a result of that really drill down and address the root causes of inequities that we see: poverty, inequality, and then the lack of access. And I want to kind of wrap up here by saying that we don't want to just expand out the table, but also make sure that we're including new people into those partnerships. And I think technology is an important way in which we can it's a really promising way that we can focus on nutrition equity, especially in today's interconnected world. Leveraging the power of data analytics, artificial intelligence, and other technologically based programs and initiatives can be a really targeted way to have comprehensive strategies towards nutrition equity. For example, we can use social media to be able to disseminate out culturally responsive and adaptive nutrition education. Or we can partner with food retailers like Westgate or delivery services or other technology companies to be able to provide food options to everyone, regardless of their location or their socioeconomic status. And by leveraging those new partnerships and by expanding our table, we have the potential to really transform the way that we approach public health and provide more integrative care that prioritizes nutrition equity. And with that, I want to turn things back over to Bernadette for a moderated discussion. Thanks.
Thank you very much. That was great. So now, thank you again to all of our panelists. I think we've learned a lot today, and I think we've got even more to learn. So I guess we're going to start with a couple of questions, and while you're all thinking about some questions. So the first thing I want to ask is, I know there's a lot of students out in the audience, and they're thinking about, I want to work around, or I want to work on nutrition security. So what does training look like? When should they start? What kind of degree should they expect? And maybe what kind of job would they be likely to get?
Sure. So I want to acknowledge all the students who are present here, especially the ones it's hard to come to health sciences. So thank you so much for making your way out to this event, including some of my public health 139 students. And I think that that's kind of the first step, having more of these types of events. There's enthusiasm, there's engagement, everyone has a role to play. And I think our program can really support capacity training and breaking down silos, even having panelists from these different, as a part of participating in this, I've met folks here at different schools and different programs and in the community. And I think promoting and providing a supportive environment for students to participate as research assistants, right? So being clear and more upfront about these investments. The scholarships are really fantastic with a targeted focus on nutrition. So the MS in nutrition science is really promising. We have a large bachelor's degree, 2 large bachelor's degree programs, an MPH, a PhD program. So being intentional about promoting nutrition for folks who are studying epidemiology, so more nutrition epidemiologists, more and thinking clearly about how we can integrate nutrition into existing coursework is one of the ways that I hope to do this. But also participating and supporting these structures, right? New faculty and this new, really exciting new nutrition policy faculty that we'll have. So I am grateful for the investments, but I think part of it is partnering with students and partnering in an authentic way with community partners, but creating opportunities for students to engage and get this training. And I will pass it on to the registered dietitians on the panel to answer that question.
Thank you. I think that was a really great response, Denise. And I think that you really highlighted that you don't need to be an RD or to do a dietetic program to be involved in this field. So we've got 3 RDs here and we might be doing research or community work in that field, but you know, public health, nutrition sciences, there's other ways that nutrition can be incorporated into your learning. I do take undergraduate students into my research lab, bio sci 99 students, and also public health 99. And that's really, I mean, I love it. I love mentoring the undergrads and having their input on, you know, what we do and them asking research questions as well. So taking components out of my bigger work, maybe clinical research, and looking at it from a different lens as well. So they're great opportunities to get involved, look at the faculty profiles and see who you might want to work with and just reach out to them.
And once you have those incredible skills, I think the next thing is to reach out to those community partners who are already doing the great work in the community, and then bring those excellent public health skills. Just giving one example, Denise mentioned universal school meals. California is leading the country in that effort. We know it to be a successful intervention, and the rest of the country is going to be looking towards us for the research to show this works. So our schools are implementing it already, and you have the skills as public health scholars to be able to help out with evaluation and showing the equity impact of this policy intervention. And that can really be leading the way for the rest of the country.
And Evelyn, you know, Northgate really is a model for worksite wellness, and you've really created a lot of that with your degree in nutrition. I don't know if you want to talk a little bit about that experience or that journey for you.
Sure. It was actually through the nutrition store tours that I met my first registered dietitian. I had never known that degree existed, right? I came to UCI, I was an English Lit major. So I was doing some grant writing that led to those store tours, right? So sometimes you find your ways in unexpected ways. You find yourself here, but I think as long as you lead with passion, you'll find a way to kind of, passion is all you need, and you just steer through and you'll find your way. But yes, any experience you have that you bring to the table is very, you know, beneficial in anything you do. So yes, I was a little different on my way here, but I think the path brought me here and it's made me stronger for it.
What about questions from the audience? Yes.
I'm a health policy researcher, should be the person to answer that question. I mean, I think that it speaks to the growing importance in public health. We've started to recognize the importance of the political determinants of health and policy making. And I'll also encourage you to think about policy implementation. Sometimes policies are adopted, but they're not implemented equitably. That's a new area that I'm focused on. So universal school meals is a good example. That was actually national policy. It was part of the temporary adaptations during school closures. So the USDA adapted by making universal school meals available through different distribution models nationally. And because of political reasons, you see that map that only certain, wasn't adopted as federal policy. And it really came down to more political and ideological factors that some states are really, there's momentum in this. And so I think this is an opportunity for us to think about research, the effectiveness, thinking about even educational outcomes, not only nutrition and health outcomes. We actually know that healthier school meals are effective in terms of improving the diet and nutritional outcomes for students and reducing these administrative and policy barriers for families. But one of the challenges also, it's a different domain. So what are the educational outcomes associated with this policy? And that can be a way to speak to, bringing in more folks, focus on education and not health from schools. So I think that would be a way to kind of help address some of the political challenges, but also we need more folks to think about the cost of these programs. The cost of these meals is actually very little money. But there's really innovative ways to think about healthier meals at a low cost that also, what are the costs on these populations in the long run, right? In terms of the diet related disparities that we see. So as a researcher, I say, not only research, but partnering with other folks in other domains that could really speak to educational outcomes, for instance.
That's what I answer. Okay. Other questions? Yes, behind you and then the woman in the front.
I have thoughts, but you're in my class, so I can follow up with you separately. And the class in general, I will pass it on to, do other folks want to say something? Yeah.
Thank you. I think that's a really valid point and totally agree with you. As a dietitian and I see patients, I don't like to focus on BMI. I mean, it is very much, in the medical record and it's always documented and it's important, but it's only one part of the picture. And I think overall, looking at cardiometabolic health broadly, which can include risk of diabetes, risk of heart disease, high blood pressure, because at the end of the day, why are we maybe concerned about BMI? It's because of those conditions that it is associated with, but it's not always. So somebody could have a raised BMI and be what we call metabolically healthy. So I don't know, I think there is a need for change in maybe the medical system as well and how we focus so much on BMI as well as in training. And it's good that you pointed that out in your own studies. So maybe markers, like there's other biological markers that we can use, but they usually require maybe a blood draw or a blood pressure measurement to get them.
I agree.
I certainly agree as well. And anyone that is in that kind of healthcare practitioner would probably say that you never use just one metric to make all of your clinical decisions. And we shouldn't be doing the same thing with kind of public health efforts either. We shouldn't have one kind of thing telling us the entire story of someone's entire lives. And just as Karen mentioned, I think the medical system is changing with the acknowledgement that BMI isn't everything that we might have thought it was, even though it was a very simple and easy to do metric that provided us some answers about some things. It never gave us the whole story. So we have students just like yourselves that are now coming through and kind of changing that and asking questions about that narrative and say, what are better metrics? And maybe it is cardiometabolic health markers that we do turn towards to tell us a more comprehensive kind of picture. I will even just say, I work on dietary clinical trials, and I can put someone on a weight loss diet and never mention anything about weight or restricting calories. And I can still see a reduction in weight just by emphasizing more healthy fruits and vegetables. Let's get more whole grains in your diet. So there's certainly ways that we can still have the same messages without ever mentioning weight, without ever focusing on restricting calories or something like that. So great question.
Do you want to say something onto this? So we have one person here and then Dr. Mallett.
picture, and I might get Denise's input as well. But yeah, I think so, because for low-income families, there is usually that gap between starting school. So that's when they get their school meals. But yes, in that first 1,000 days period and up until they start kindergarten, there's usually a gap in their access to food services. WIC obviously helps to cover it, but it just might not be enough sometimes. So I think it'll probably make it more equitable if sort of all of these very young children are in a preschool setting. So I think it's a really good, thanks for highlighting that.
Sure. I think it's really valuable to think about, as I mentioned, other spaces, right? And how going back to the social determinants of health, a lot of these determinants are linked. And so I talked about paid family, medical leave being really important in part for postpartum, increasing the breastfeeding rates, exclusive breastfeeding rates, but thinking about supportive policies more broadly, some of it, thinking about early childhood care, a lot of women have left the workforce during the pandemic. A lot of Latinas have actually left the workforce disproportionately to some other groups and are not coming back because of childcare. And so thinking about poverty alleviation, economic supports, and economic policies that also have nutrition and health outcomes are really important. And it goes back to that life course perspective as well. So I encourage people in public health. It's a broad umbrella, but how are we connecting, thinking about supportive policies and evaluating those supportive policies for health and nutrition outcomes?
And last question, Dr. Mallard.
I could spend a couple hours on this issue, but I won't. So I think you bring up a really important nuanced aspect. So we're touting school meals and universal school meals access, but that same study would use focus groups in different large public high schools in South Los Angeles after implementation of the Healthy Hunger Free Kids Act, which had a component to improve the nutritional quality of the food in schools. So part of it in these schools, they were seeing like salad bars for the first time. And we asked about that. And the students were really, really excited about the fresh produce. They also were not excited. They used the word nasty back in the day a lot about some of the other reheated foods that they knew were not being prepared on site. And so it's actually really similar. The students are really excited about some of the fresh items. So some of these schools are so large, like we never get to eat that. It runs out, or it doesn't look great by the, or we don't have time to eat that food. So there's so many components to school meals and structural barriers to school meals that are really important. During the Trump administration, there were some regulatory kind of rollbacks to some of the nutrition standards in school meals. So those are really things that aren't as publicly visible that we need to pay attention to, right, with policy implementation. And more recently, there's been more of an effort for improving the nutritional quality of schools. And that should go hand in hand with access, right? When you think about the 5 food security components, how are they, you think about multiple aspects, not just one or the other. But yeah, I think that it speaks to the importance of nutritional quality and type of food, but are they able to sit down and eat a meal? And we were, other quantitative studies with large sample sizes found, no, they don't have enough time to sit down and eat that meal. Or they run out and they don't eat the whole day. So how are we thinking about these different components in tandem? It's a really great point. Do other people?
I'll just even share that again, it goes back to bringing new people to the table. From my experience as a registered dietitian, I during my dietetic internship, I was in elementary school where they were trying really hard. It was in Austin, Texas. So they were really promoting local, fresh vegetables and were really passionate about it. But the cafeteria itself was built in the 1970s and they were still using that kind of equipment. So while I was there, let's get kids to eat broccoli. They were like, we would love to do that, but our ovens are from 1972, well before you were born. And so again, thinking about all the different aspects, not just diet quality, but can these schools even, do this within their capacity? Do the wonderful food service staff know how to be able to prepare those things? So it goes back to the education kind of model. So really coming at this from multiple angles to really kind of address that kind of concern.
Well, time is up. I want to first thank our panelists for a really wonderful discussion. I hope that we can come together in these forums to talk more in more of these lecture series about health equity, social determinants of health, and all the ways that all of us can work together to really advancing health and wellness for all. Thank you all so much for coming, for supporting public health during National Public Health Week. And we look forward to speaking with you later upstairs, or now upstairs at our reception. Thank you again.